Hey, pause for a second, what? Yes, ladies, this message is for you. Stop doing these things just because you think they might help. I'm going to clear up 3 habits you should quit right now to help improve your bladder health. I'm Dr. Rena, a urologist and pelvic surgeon. Let's get started. Number 1, stop washing your vagina. Wait, what? Yes, I'm serious, stop washing it. The vagina works like a self-cleaning oven. In fact, washing it can actually do harm. It naturally maintains a healthy pH balance all on its own. You don't need to douche, wash inside, or use any products there, because your body already handles that perfectly well. When you do wash it, you may disrupt that balance and remove helpful bacteria that protect your natural pH, which can lead to issues like yeast infections. You can gently clean the mons area, the hair-bearing outer region, with soap and allow soapy water to rinse downward, but beyond that, nothing more is needed. Overwashing can also dry and irritate the tissues, which might make you feel like you have a urinary tract infection or cause discomfort during intimacy. So I strongly encourage you not to fall for all the over-the-counter products that make you feel like you need extra help to stay clean. You are already clean, and normal discharge is completely natural. Now, if your discharge changes color or has an unpleasant odor, it's important to see your gynecologist to rule out infection. Otherwise, there's really nothing more you need to do. So what can you do if you notice you're sensitive and irritation happens easily in that area? Choose 100% cotton underwear and be sure to wash new underwear before wearing it. Other fabrics can irritate the delicate skin around the vagina. Also, be mindful of pantyhose. Make sure they have a cotton crotch. Avoid scented or hygiene products like douches, since they can cause irritation. And take a look at your laundry detergent. Using unscented options is best, as fragrances can also be irritating. Number 2 is Kegel exercises. These are pelvic floor exercises meant to strengthen those muscles, and they definitely have their place, but not everyone needs to do them. There are a few reasons for that. First, Kegels aren't always as simple as they sound, and many people end up doing them incorrectly. So when I tell patients to do Kegel exercises, I usually tell them to lie down on a bed, so you're only engaging your pelvic floor muscles while doing the exercise. Think about lifting up and inward. Avoid tightening your buttocks or your abdominal muscles, because that's not the correct technique. Also, with Kegel exercises, relaxation is just as important. Just like at the gym, you can't keep doing reps without taking breaks, or it can lead to discomfort. In women, doing Kegels constantly can actually result in something called a high-tone pelvic floor, which means those muscles stay too tight and don't relax properly. If someone already has a high-tone pelvic floor, continuing Kegels can actually increase discomfort and pain. So how would you know if this might be happening to you? You could notice urgency, feeling like you have to go right away, or frequency, meaning you're using the bathroom very often. You might feel pain in the vaginal area, your lower abdomen, or even your back. Some women also experience constipation, where it's difficult to pass stool, and that can be related to a tight pelvic floor as well. Because of this, before starting Kegels, if you're having any of these symptoms, it's a good idea to see a urologist, gynecologist, or a pelvic floor specialist to properly evaluate your condition. Now, before I share the final point, let me tell you about a study. This research looked at more than 6,000 women and asked questions about their bathroom habits, how they used the restroom, what behaviors they followed, and whether they experienced bladder issues. The results were quite interesting. They found that 89% of women were concerned about the cleanliness of public restrooms, and 61% avoided using them altogether. About 94% said they used the bathroom before leaving home, while 56% admitted they held their urine during the day until they got back home. These behaviors can actually be problematic and may contribute to urinary symptoms if you're experiencing them. Overall, the study showed that women with more bladder issues were more likely to practice habits like just-in-case bathroom visits, delaying urination until they felt it was the right time, or even straining to start urinating so they could finish faster. This leads me to the final point. Don't hover when you urinate. And I understand, just like you, I'm also concerned about how clean public toilets are. But if you look at the research, some studies have actually shown that when your phone is tested, it can be dirtier than many public toilet seats. So try not to stress too much about public restroom cleanliness. Use a seat cover or whatever makes you feel more comfortable, but it's really important that you don't hover. The reason is that urination depends on your pelvic floor, a group of muscles that forms a supportive base under your bladder, being able to fully relax. When you hover or do a partial squat, you're not truly sitting, and those muscles stay tense. As a result, when you try to urinate, the flow has to push against that tension, making it harder to empty your bladder properly. Over time, this can become a real issue. If your bladder isn't fully emptied, it can increase your risk of repeated urinary tract infections. I always remind my patients who come in with bladder concerns to sit all the way down, relax, and allow the bladder to empty completely. If you're hovering or rushing, you're likely not emptying fully. Many of my patients come back and tell me, "You were absolutely right. I'm emptying much better and I feel so much better." Now, once in a while, if you come across a truly unpleasant restroom, it's understandable to be cautious. But most of the time, do your best to sit properly and empty your bladder fully. If you found this video helpful, be sure to subscribe to my channel and share it with your friends. Thank you so much for watching, and always remember to take care of yourself because you truly deserve it.